Okay, so we're recording. Hi, this is Alice Emerson, chapter president of the Charleston Metro Holistic Chamber of Commerce, and I'm here with Janelle Solomon. And welcome, Janelle. Janelle is I'll let you introduce all your credentials. I will, but she's been a founding member of the Holistic Chamber of Commerce, and she is now also our social media ambassador. And so, with it being October and everybody's aware of breast cancer awareness, but Janelle has a different take on this. And so we're going to have her join us and tell us about her services and what you like to focus on during October. So go ahead, Janelle.
Thank you so much for having me, Alice. And I would love to talk about breast health awareness, as October is the month to remember everyone who has struggled with cancer or is currently struggling with cancer, and then everyone else who has not been affected and who wants to remain healthy. So it's all about prevention and being proactive. So one amazing way that you can screen for breast health is through medical thermography. And I'm sure some of you have heard me talk about it already, but for those of you that don't know, it is thermal imaging of the body to detect inflammation and potential disease. Now, our equipment is FDA cleared for breast cancer detection and has been since the 80s. So it's an extremely effective and completely radiation-free way to screen for breast health. And there is zero contact involved in the screening process. So I know that's important to mention, especially these days. A lot of people are worried about leaving the home or being in close contact with others, and we can safely remain in social distance while doing this screening process. So that's important to mention as well.
That's very important. And a lot of people just don't want to be touched. I mean, to go through a mammogram, which is, I'm not knocking it at all because it serves its purpose as well. But what you do as your certification is with VTI, correct? So that's
yes. So I'm sorry, I forgot to actually introduce.
No, I wanted you to explain that because I think it's really important because this is sometimes overlooked, doing thermal imaging as something that isn't as respectable as, a reading the mammogram, let's say. Right. So I just really want to bring some credibility to your field for people who just don't know. So
yes, thank you for reminding me of that. So yes, I am a certified thermographic technician. And so that means that I actually take the images for the patients and then I send them off to the interpreting doctors. And they are with Breast Thermography International. So I'm a member of that organization. It's a nonprofit organization. And then I'm also a member of the Professional Academy of Clinical Thermology. So all of us underneath the BTI umbrella, we all have those affiliations. And so those interpreting doctors, there's 3 levels of interpretation that this set of images will undergo. So it's very thorough, and then the patient will receive their images and their report within 1 to 2 weeks with all the details of what the interpreting doctors had to say in terms of comments, suggestions, recommendations, and then of course all the temperatures and all the science behind exactly what we do. So
that's very amazing. Yeah, it's very thorough. And I think that's really important to know that it's just not, the individual taking the images, interpreting it, that there is a science. And this has been around for a very long time. Like you said, what, the 80s is really
when it's been around since the 50s, but this specific technology has been cleared by the FDA for breast cancer detection since the 80s.
Okay. All right. Since then. Yeah. So I like what you had said about it really being proactive, right? And so it's really not something, well, I guess you could do it in a reactive phase, like if you had a diagnosis, but your emphasis is really on the breast health awareness to just get these screenings. So tell me how these screenings can really help, in the preventative stage.
Absolutely. So as many of us know, cancer takes time to develop. Of course, sometimes it progresses very quickly, and then other times it takes years and years and years. So with that, when we're doing these screenings, we get a baseline. So that's your initial screening where we get all the temperatures of your body, and specifically the breast area. We do full body imaging, but we focusing on breast health awareness right now. Say we get a set of temperatures for your breast for your first screening. Then in your comparative study on your follow-up exam, whenever the interpreting doctors recommend that to be, so they could say 3 months, 6 months, or 1 year, depending on your results, we would then compare those current temperatures to your previous initial temperatures. And then if you have increase in temperature or decrease, or if they're staying the same, that's going to tell us a lot about what's going on in the body. So if you have an increase in one certain area that was looking a little suspicious, that's not a good sign. We want to avoid that. So basically, cancer is hot. And so we're detecting that heat and inflammation that the blood flow and blood supply to a potential tumor would create. So even in the very, very early stages, we will pick that up. So that's how the prevention comes in. We'll see something way before it could be an actual physical lump or bump in the breast.
That's amazing. I mean, it's such a useful tool, in your preventative care. And these are images and reports that they can actually take to their conventional medical
Yes.
doctor, correct?
Yes. Now,
And
whether
it's
or not
respected in the medical field.
Yes, any person in the medical field could read the report easily. However, they may have not been trained on what thermography is or how exactly to read, exactly what they're looking at. Of course, any medical professional can figure out what it says, but we do encourage patients to bring their reports to their doctors so that we can get more exposure, because it is such an incredible screening tool. We think everyone should know about it.
Yeah, I love that it's no radiation, because it seems like, I'm not sure, we're in the holistic community. So, a lot of people understand in this community how x-rays, MRIs, scans, and all of that are really detrimental to get that really often. And there are times where they're just given. And so I like that this is a screening that can be done, like you said, 3, 6, 9 months, at 12 months without any concern of exposure to radiation. So very safe, but yet very thorough, accurate, and a great pre-screening tool.
Yes.
Yeah. Well, thank you so much.
I
And so
appreciate
if
you
somebody
bringing
wanted to
it up.
schedule with you, tell us where we can find you and how we can set up, if somebody really wanted to start doing this. And at what age do you normally recommend?
Yes, so we screen men and women. It's not just for women, and children as well. Children, actually, we screen for free. So just for the interpretation cost, which is $55 for children, if they are scheduled on the same day as their parent. So that's huge. You can start as early as if someone can pose for a photo, then they can do this screening. So it's never too early to start. And so if you do want to get scheduled and you are local here in Charleston, you can go to the website flowwell.org and check out all the different locations that we have throughout. We have Mount Pleasant, West Ashley, North Charleston, pretty much anywhere. We've got a location near you, so you can choose that location. And then if you are a member of the Holistic Chamber of Commerce, I do offer a discount. Please make sure that you note in the How You Heard About Us section that you're a member, so that we can apply that discount for you.
Well, thank you very much. That is perfect. So I'll put all that information in the notes as well. And because I know that you see patients often, and you have traveled to see it. So just for other practitioners that might be hearing this, is this something that you can do for, let's say, other chiropractors or other wellness centers, and you can, you know, add this to their services like you would
Yes.
travel?
Absolutely. There's a few people that I'm speaking with now that we're always looking for more businesses to to partner with so that we can, help them, they can help us, and basically just spread the word and let more patients know that the service is offered. So absolutely. And you can contact me personally on my email, Janelle@flowwell.org. So if that's something that you wanted to discuss, I'd be happy to.
Perfect. I'll make sure I put all that information in the post so that people can reach you. And I appreciate you taking the time and spreading the word about breast health awareness.
Absolutely.
Yeah.
Thank
Well,
you
thanks,
so much,
Janelle.
Alice.
You're welcome. Have a great day.
Thank you. You too.
All right.